Good morning, everyone. It is such a distinct pleasure to be here, and thank you, Katie, for the warm introduction. And it's always a privilege to follow my friend and UC Health colleague, Atul. So as mentioned, today is going to be a day which is very close and near and dear to my heart. And one of the things that I have devoted my professional career to is making sure that we advance our healthcare in order to achieve health justice. But one of the most important levers of achieving health justice is technology. But we have to be able to build it in a way that is responsible and that truly benefits all people. And as I move on over here to grab the clicker, I want to make sure that we actually start off with some of the important aspects of what is artificial intelligence. So Atul already mentioned really what artificial intelligence is and all of the various different forms. But I like to highlight it as where we are with our technology, in which that technology is able to do predictions, recommendations, and then also solve highly complex problems similar to we as humans. And when we think about all of the various different use cases, I like to divide it into two primary categories: clinical uses and administrative uses. And if we go directly into some of these different areas, we can think of how machine learning actually helps us with predictive analytics in order to treat various different patient populations. Or if we're actually advancing virtual health, we're incorporating all of the biometric data from multiple different outlets so that we can design treatment regimens that are specific for an individual or a population. But what about all of the administrative uses? NLP, as we know, as Atul just mentioned, but then also the generative AI aspects of this, which can not only help providers of thinking about what their diagnoses may be, but also help our patients. But then when we think about even robotics and how robotics are transforming our supply chain processes, these are all forms of artificial intelligence. So with this new emergence of all of this technology, the truth is there are great potential benefits, but there's also risk that we have to be aware of. And so as a health justice warrior, when I think about all of the benefits that are here, I think about the fact that, wow, we can actually bring healthcare services, especially to those populations that have not had equitable access. And so making sure that these patients receive complex primary care, especially as well as specialty care, regardless of where they live in our country or in the world, or regardless of the number of practitioners that are there. But we also know that some of the key benefits of artificial intelligence include lessening the provider burdens so that I can actually spend more time sitting with my patients versus having the competing demands from all of the administrative tasks that are looming over my head. We know that AI has also advanced so many different therapeutic breakthroughs as well as pharmacologic breakthroughs. And we also know that AI has the potential to truly increase patients' engagement with their healthcare as well as their understanding of their healthcare. But with these benefits actually bring significant risk. What I like to say is that artificial intelligence mirrors human behaviors and practices. So if we are not careful, our implicit biases, our explicit biases, and our structural biases will be incorporated into our technology and amplified 1,000 times over, worsening the gaps that we already have. In addition, if we're reliant on technology too much, we can actually decrease our own clinical gestalts as well as clinical trainings, leading to unsafe, ineffective practices for our patients. The other aspect of the potential harm of artificial intelligence is that we already have gaps in terms of our outcomes, where some populations do better than others. And guess what? We really don't always know the answers why. So if we build upon this current existing data without exploring why we have disparate outcomes, this technology will continue to worsen the gaps that we already have. And then, of course, the more technology we have in healthcare, the greater the risk for cybersecurity attacks. all of these are risks that we have to consider. So with all of this new technology, there's a meme here from Salesforce that actually says, well, gosh, if artificial intelligence is the wild, wild west, who's the sheriff? That's a really good question. And if we ask many of our officials, they will say there has to be a balance between innovation and regulation. And I strongly believe in that as well. So what have been some of the current responses, and especially from our government? And now most of these frameworks that you see here on the slide are based here in the United States, but of course we also have some from the rest of the world. And so we already know that the White House has come down with various different executive orders about safe and trustworthy AI, but also the American Medical Association published its own framework to talk about how to guide augmented intelligence. The Office of the National Coordinator, of course, an agency that is very near and dear to my heart, in December of 2023 released the HTI rule, or the Health Data Technology and Interoperability Rule, in which we, as the HITAC, provided over 40 recommendations to the Office of the National Coordinator to be included into this rule. And I'm very happy to say that they incorporated the vast majority of those recommendations. But then we also have the World Health Organization, which we'll go into a little bit deeper, and then of course NIST, or the National Institute for Standards and Technologies, that have published an AI risk management framework, and they just updated it as of this past April as well. So of all of these different models, I must say that my favorite model is the World Health Organization's model. And the reason why I really favor this is because it's 6 primary principles, super duper simple, and it clearly outlines that it's important for artificial intelligence to be inclusive and rooted in equity. And it has to be responsible and sustainable, not only to humans, but also to our environment. We are part of so much more than just our human nature. We have to be responsible for the environment as well. And then going back to the ONC HTI final rule, one of the aspects in the HTI 1 rule is the specific carve-out for what's called decision support interventions, otherwise known as DSI, also otherwise which replaced the nomenclature for clinical decision supports. So in the HTI 1 rule, underneath the DSI certification, it says, and this is very important for everyone in this room, it specifically says that developers of new predictive decision support interventions have to adhere to certain criteria. And in order for the new technology that is going to be certified for the ONC, it has to meet these criteria, and it has to go into effect as of right now. So what are some of those various different criteria? There's a lot of information on this slide. This is directly from the Office of the National Coordinator. But the purpose of this is that ONC wanted to achieve 4 primary goals. It wanted to make sure that all of these various different predictive analytics were really promoting increased transparency. Too often, our analytics have been black boxes. We have no clue how these models were designed, how they were tested, what the outcomes were, and therefore ONC said, if you are going to incorporate these predictive analytics into certified health IT, which is electronic health record systems, and other technology certified by the ONC, it has to meet that objective. In addition, the whole purpose for increased transparency was also to promote greater trustworthiness with those providers who are using the technology, but also for patients. And then also building a much larger ecosystem where we as healthcare providers, as well as healthcare organizations, can evaluate these DSIs in order to ensure that they're adhering to 5 primary principles. Are the technologies fair? Are they appropriate? Are they valid? Are they effective? And are they safe? What we call the FAVEs. And then last but not least, of course, advancing health equity by design, ensuring that all of these different algorithms and interventions equitably supported all patient populations. So if you think about it, if ONC has been looking at predictive analytic rules, or DSIs, Well, who's monitoring the rest of artificial intelligence in healthcare? Well, this is another slide directly from ONC, which I absolutely love. And it actually shows the 3 primary US agencies that are responsible for artificial intelligence monitoring: the Office of Civil Rights, the Food and Drug Administration, as well as ONC. So what does the Office of Civil Rights actually do? When the Office of Civil Rights has clearly stated, okay, healthcare providers and healthcare organizations, you can adopt whatever technology you like. However, it is your responsibility to ensure that it's not discriminatory in nature. And if we find that the technology that you are using is discriminating against any patient or patient population, you will be held responsible. Now, that liability can be passed off directly to the health technology companies, but it is the healthcare providers and their companies that are overall responsible. Now, what the Food and Drug Administration has said is that if there is some type of software that is powered by artificial intelligence and is acting like a medical device, well, that falls into our jurisdiction. And therefore, it has to go through the same FDA process as any other medical device in order to ensure that it is safe and effective. And then last but not least, as I previously mentioned, what ONC has stated is that if there are any new decision support interventions that are incorporated into certified health IT, that technology must be proven to be responsible, transparent, and have an appropriate risk mitigation strategy. So in essence, these are the 3 sheriffs currently that are involved. So when we think about regulation, that's great, but what about innovation? What are we responsible for doing? And can we actually start to innovate in a way that actually helps to promote greater equity and justice in all of our different technologies? There's 3 critical data errors that I would like to outline to everyone in this room. And after today, I hope that none of us in this room make these 3 critical data errors. And they include biased collection of data, biased interpretation of data, and interpretation of biased data. Now, the reason why these are critical data errors is because they automatically flow into our artificial intelligence and other forms of health technologies. And we'll talk about how that actually shows up. Well, it shows up directly in terms of all the data biases that we can pull out of the different models. Number 1, actually looking at incomplete data in its entirety, where we have data sets that are completely missing data about certain populations or groups. And therefore, all of the recommendations that come out of the artificial intelligence are skewed directly towards the data that's in the system. And that kind of makes sense. But then we also have historical biases, where some of our data is actually built upon data sets that are rooted in prejudice and racism and other forms of discrimination. And then there's also sampling bias, where we have not actually intentionally incorporated multiple different populations so that there's full representation of all the groups that that data should reflect. And last but not least, measurement bias, where there are inconsistencies or incorrect analyses of the various different data that leads to ineffective and potentially unsafe recommendations. Now, these 4 different types of bias that we find in our data directly plays a role in our healthcare utilization models, directly into also our diagnosis models and our risk predictive models, leading to disparate outcomes when it comes to different patient populations. So let's see some examples of that. So the first I want to just really focus on is our healthcare utilization. And you have 2 different examples here. And the first one is the Optum care management process, in which this algorithm looked at healthcare costs. And what it actually did, and it was a well-intended study, it said, well, those patients that have the highest level of healthcare costs, well, we're going to make sure we're going to give them more wraparound comprehensive healthcare services. Well, guess what the model actually predicted? The model recommended that there was more healthcare given to white patients versus low-income Black patients. And the reason why is because it was only looking at cost of care. And it did not incorporate the fact that low-income patients and also Black patients within this country have a long history of not being able to access healthcare services in a timely manner. Therefore, their healthcare costs are lower. So this is a very important finding, and fortunately, Optum corrected this model. But we can also see this in emergency department triage systems and some of the new AI models that have come out of that. Now, I have been an emergency physician for almost 20 years, and I still practice to this day. But I'm also a health services researcher by background, and there are numerous studies out there that have demonstrated bias in our emergency department triage systems, which means if we have two patients that come in with the same exact complaints or symptoms, some groups will be triaged at a higher severity score than others, although they're coming in with the same exact symptoms. So therefore, if now we're building artificial intelligence models using the biased data that has already existed for decades, of course these new models are going to triage minority patients and low-income patients and women at a lower level than their counterparts. Because once again, AI is just a reflection of we as humans. So this is something very important for us to address. But what about in terms of diagnosis? Well, now this is a very important aspect for all of us in this room to consider as we're innovating and creating new technologies. And the main thing I want to bring your attention to is the use of historical clinical algorithms that may be rooted in bias or some form of discrimination. A prime example is the eGFR, or the e-glomerular filtration rate. Now, this has been a widely used algorithm across the entire healthcare industry that was used to actually measure individuals' kidney functions. However, there was a race-corrected factor in the eGFR, and which, due to a number of inappropriate, methodologically flawed scientific studies that were rooted in medical racism, what happened is that this clinical algorithm essentially said the kidneys of Black patients function differently from the kidneys of all other patients. And what that led to was a delay in kidney failure for Black patients, as well as the delay in receiving kidney transplants and disproportionate amounts of death for Black patients compared to other patients. In 2021, the National Kidney Foundation, as well as many other entities, said that the race-corrected eGFR was incorrect and unjust, and they made a call to action for all healthcare organizations to eliminate it immediately. UCLA Health, as well as all the rest of the health systems within UC Health, eliminated race-based eGFR, and we have seen significant improvement in health outcomes for our Black patients, as well as many other patients of color. What we put into our technology has true life and death implications, and it's important for us to recognize that. We've also seen the same thing in pulmonary function tests, which we at UCLA Health have also eliminated any race-corrected findings. And then we've also seen many of these same differences in terms of dermatology, because our models are not trained in order to pick up various different shades of people's skin color. And so this brings me to a very important piece that I want all of us to reflect upon. Race in itself is purely a social construct. It has no root in biology whatsoever. And in addition to that, the Human Genome Project told us and taught us that 99.9% of all of us share the same exact genetic material. Now, some of our genes may be expressed differently, which makes up our eye color, our skin color, or our hair texture, or how tall we are, or how short we are. But all of our hearts function the same. All of our lungs function the same. Our kidneys function the same. And our skin is the same. And so it's not one's race that is actually a risk factor for disease or poor outcomes, but it's one's skin color, which actually allows them to be subjected to racism, which actually can lead to worse disease and poor health outcomes. But we've seen some of these factors also when it comes to various different risk predictions. We have seen how race has been used inappropriately and has led to increased numbers of cesarean sections amongst Black and Latino women here in the United States. But in addition to that, there's also gender biases, where we know that cardiovascular data sets tend to predominantly be focused on male patterns. And therefore, when these models have been deployed amongst women, we've noticed that they have underperformed in diagnosing cardiovascular disease. Natural language processing is also not exempt from some of these various different biases, in which we've seen models that have been trying to predict the risk of mental health in various different populations that, number one, NLP does not perform well in non-English patterns or non-English environments, and NLP often has a very difficult time picking up cultural phrases or nuances that may actually indicate mental health disorders, therefore leading to less likelihood of treatment as well as less referrals. So now that we know how bias can show up in our technologies, what can we all do about it? Well, there are three primary principles that I think are incredibly important in order to ensure that we collectively are building ethical and just technologies. And they include inclusive representation, transparency, and a true commitment to eliminating harm and bias. Let's dive into each one of these. Number one, inclusive representation. And I love this slide because it shows people of all experiences, of all identities. But as we develop our initial data sets, as well as our training data sets to build our artificial intelligence models, it is important to have representation of all the potential people that that technology will be used on. Now, this goes beyond just demographics, such as race, ethnicity, gender identity, sexual orientation, faith, etc. This actually goes even in terms of incorporating people with diverse abilities. It is important that we incorporate people that have cognitive and physical disabilities into our data sets, which are often also highly underrepresented. But we also have to include people that are living with rare conditions that are hardly ever in the various different models that we are creating. Another important factor is that we know that there are various different vulnerable populations out there that tend to have a higher susceptibility to poor outcomes. We have to incorporate them into our data. We know this, and therefore we cannot exclude them and have to take intentional steps to bring them into how we're developing our technology. And then also, one of the various different phrases in my culture is nothing for the people without the people. So what that means is that we have to incorporate diverse voices along the entire technology development lifespan, all the way from design all the way to post-implementation audits. We have to include the people in which the technology will be used to serve and ensure that we have various different vantage points that can actually pick up bias when others may not see it. The second primary principle is transparency. Transparency is so incredibly important as we're building these different technologies. We can no longer have a black box where all of the magic is made. We have to shine a light on how all of these technologies are created and how they perform on various different patient populations. But then that information has to be communicated out appropriately, not only to the providers, but also to the patients. And all of us in this room, we're all techies, okay? And oftentimes we tend to use a lot of jargon as well. Well, we have to be able to communicate in forms that are clear and succinct and jargon-free. And when we're also communicating with our patients, regardless of the education level of our patients, we need to communicate on a grade 6 level or lower. That is incredibly important for comprehension. And then last but not least, a true commitment to decreasing and preventing harm and bias. And that means pausing and actually saying, is discrimination here in this model? Does this technology perform the same on everyone, or is it causing unintentional harm, or is it excluding various different populations? And as I mentioned before, really stress testing these technologies, especially for those groups that we know have had worse outcomes than others or have not had the access to the various different forms of technology or health services in the past. But then I also really urge everyone in this room to question building upon either historic or modern clinical algorithms that may be rooted in bias or any other form of discrimination, such as racism or sexism. It is really important that we start to eliminate all of those various different practices so that we can ensure we're moving more towards a just future. And last but not least, building the technology and rolling it out and saying, yay, this is so fantastic, is wonderful. But this technology has to be monitored year after year after year to ensure that it is functioning as designed and again is not causing any harm to any individuals or populations. So as we put all these pieces together, imagine a new world with artificial intelligence and other forms of health technology, where healthcare AI can in fact be effective in mitigating health inequities. Imagine also a new world where our technology is able to elevate above the biases that we as humans have. And can you imagine a new world where our healthcare technology, and especially artificial intelligence, can learn from the past mistakes we as humans have made in order to ensure we do not make those mistakes in the future? We have the ability to do this, but we have to make sure that we're taking the intentional steps in order to achieve this. So in recap, yes, healthcare AI is here. It's actually been here for a while, but it's even more prevalent. And therefore, we have to ensure that it's benefiting all individuals, all populations across the globe equitably in order to improve their health and overall social well-being. But in order to do so, we have to avoid those 3 critical data errors and ensure that that is not rolling into our technologies either. And then lastly, let's us all commit ourselves once again to ensuring we're building new health technology that is truly and very clearly representative of everyone that technology will touch, as well as transparent, and also that commitment to decreasing harm and bias. So I always like ending on a quote, and I had to think about, gosh, which one of my favorite authors are we going to end on a quote on? And this is a wonderful quote from James Baldwin, in which James Baldwin stated, "There is never time in the future in which we will work out our salvation. The challenge is in the moment. The time is always now." This is the time that we get to revolutionize our technology to ensure that it is ethical and just for all of us. Thank you so much.
Thank you very much, Dr. Briggs. You gave us a lot to think about there. Now, you started your presentation by laying out the sheriffs on the federal level. So we got OCR, ONC, and the FDA. What I'm interested in is, who's the sheriff in the health system? Is that you as the Chief of Diversity, Equity, and Inclusion? Is that the new Chief AI Officer? Where does the responsibility lie?
So Katie, thank you for that question. I always say that it's a joint effort. And so, number one, it definitely comes down with the appropriate governance that you should have within your healthcare organization. And that should actually complete with various different stakeholders that include those from, of course, health technology. I always say you absolutely have to have your equity experts on board, but then also your clinicians, because we always have to think about how that technology may impact someone. And so one of the things that we've done at UCLA Health, and of course we do that through UC Health as well, is that we have governance committees to assess all these technologies to ensure that they are safe, they are ethical, and they are also equitable in nature. But I also think that it comes down overall to the providers as well. And that's why that key piece about transparency is so incredibly important, because if we as physicians or other clinicians are using tools, we should understand it. We should understand how the tool was created, who it was tested on, and what type of results we should see from it. So I believe there has to be multiple layers that are there in order to assess all of the various different forms of health IT as well as AI, but it definitely starts with having a very strong governance committee at the very top.
Thank you very much to Dr. Briggs.
Thank you.